So as you all know, Senate Republicans are trying to fast-track their so-called healthcare bill through the Senate, and according to Axios, Mitch McConnell is trying to force a vote on it by July 4th. Now, up until this point, they've hid this bill away not just from Democrats and the public, but also from Republicans. So they've kept it a secret, and now they're going to try to push it through the Senate as fast as they possibly can. Now, only a handful of Republican lawmakers knew what was in the Senate version of the bill up until today, and because the House version has a 17% approval rating, it's pretty easy to see why they were embarrassed about their own bill. So we're going to talk about what's in the bill, but first of all, I want to talk about how their lack of transparency with this bill makes them completely hypocritical, because in contrast, when you look at the Affordable Care Act and the debate that occurred before that was passed, The Week explains Republicans claimed that the Affordable Care Act had been rammed through Congress without anyone understanding what it was about, which is kind of like saying that the tortoise flew by the hare before that poor innocent bunny could get started on the race. In fact, the ACA was debated vigorously for an entire year. There were 79 public hearings in the House and even more in the Senate as the bill moved through multiple committees. Hundreds of amendments, many proposed by Republicans, were considered, and near the end, the Senate spent 25 straight days debating it on the floor. So there was a healthy debate about the Affordable Care Act, but they still complained. However, when it comes to their own bill and the lack of transparency surrounding that, well, it's perfectly fine if they release their shitty so-called healthcare bill just a couple of weeks before they're going to ram it through the Senate. So Bernie Sanders took the time to explain why this is problematic on MSNBC.
I am speechless when I try to describe what is going on here, because it is really literally unbelievable. Chris, we're talking about, in terms of healthcare, 1/6 of the American economy, trillions of dollars. You're talking about an issue that impacts virtually every single American in our country. And in the midst of all of this, you have a process by which right now perhaps a dozen Republicans are the only people in America who know what is being talked about, what the new bill might look like. Most Republicans don't even know it, let alone anybody in the Democratic caucus. This is outrageous beyond outrageous. This is unprecedented, I think, in the history of modern America, that you have a bill of such consequence where there is not one hearing. I'm a member of the Health and Education Committee. No hearings, no public debate. What will likely happen is that at the very last moment, on the day of the vote, Mitch McConnell will present a bill. The Republicans will, like sheep, vote for this legislation. And that's what the debate on one of the most important issues facing America will be like. It is incomprehensible.
So Bernie Sanders obviously wasn't too far off. They're releasing this bill now, just a couple of weeks before they're going to vote on it. That's just not enough time. That's unfair. So for a bill that has this low of an approval rating, that's all the more reason to really bring it to the spotlight and let the American people pick it apart, and let Democrats and other Republicans pick it apart. But they're embarrassed about their own bill, and now we know why. It's because when you look at the bill, because parts of the bill leaked, it's still horrific. So Slate explains, according to the Washington Post, which cites a discussion draft circulating Wednesday afternoon among aides and lobbyists, the plan looks much like the Obamacare repeal legislation passed last month in the House, with a few key departures. Here's a brief rundown. 1. Instead of providing Americans tax credits to buy insurance based on their age, as the House bill does, the Senate would offer them based on financial need, which is more or less how Obamacare works. But under the GOP's proposal, fewer Americans would qualify for help. Under the Affordable Care Act, households can receive insurance subsidies if they earn up to 400% of the poverty line. Senate Republicans would lower that threshold to 350%. Subsidies will also be smaller for those who still qualify. In short, it sounds like McConnell's working group is keeping Obamacare's subsidy structure but making it stingier. It is unclear who this will please. Second, the Senate bill eliminates all of Obamacare's taxes except the Cadillac tax on expensive health plans. This will please the medical device makers, investors, high earners, and insurance companies that were taxed by the ACA. Third, it rolls back Obamacare's Medicaid expansion more gradually than the House bill, according to the Post, though how much more gradually is unclear. Fourth, what about consumer protections? The House bill notoriously allowed states to opt out of Obamacare's insurance regulations, such as rules barring carriers from discriminating against patients with pre-existing conditions or requiring them to cover certain services. Sensing that it might be politically suicidal to strip cancer and heart patients of their protections, Senate moderates have reportedly resisted going down that path. Right now, it's unclear who won the argument. Fifth, the Senate bill would kill funding for Planned Parenthood, but still bar the government from subsidizing private insurance that pays for abortions, which will infuriate religious conservatives. So it's important to note that we still don't have all the details, but this is what they've done. So after listening to feedback from the public and knowing that the House version of the same bill got a 17% approval rating, they decided to hear us out and then change basically nothing. So they're shameless. Now, by some analyses of the Senate version, you can make the case that when you look at specific components of this bill, it's actually worse than the House version. So once we get all the details, then we can actually do a more comprehensive breakdown. But for now, not much has changed, and it's still an awful bill that must be opposed. But nonetheless, the Republican Party, they're basically giving us a more shittier version of the Affordable Care Act. So after learning that the ACA doesn't work, they're saying, well, here's the ACA, just strip the most of the good things that made it somewhat better. I mean, it's unbelievable to me. They have no common sense, but what they're trying to do here is they want to repeal and replace the Affordable Care Act just so that way they can check off that box, the repeal Obamacare box, and then brag to their constituents and say, look, we repealed Obamacare. We kept our promise, when they're not actually looking qualitatively at what will happen if they do repeal the Affordable Care Act with this abomination of a bill. It's not a healthcare bill. As Bernie Sanders previously argued, it's not a healthcare bill. If you strip health insurance away from millions of Americans, it's an anti-healthcare bill. So what the Republican Party is trying to do, they want to be able to keep their promise, but at the same time, they can't do anything that would actually expand health insurance to Americans or lower the prices because they've completely sold out to their donors. So they can't do anything that would rock the boat too much because they want to make sure that they still get those campaign contributions. So they want to gut a lot of the protections that was offered to us with the Affordable Care Act. And the American people, they know what's going on and they're not buying it. Hence why you see protests at GOP town halls. It's why the bill in the House has a 17% approval rating. And when you look at the Fox News poll done on the House version of this bill, it got a 21% approval rating. So the overwhelming majority of even Republicans aren't on board with what they're doing, because who is it again that is the Republican Party's most loyal voting demographic? It's older people. And what they're doing, stripping provisions that take away health insurance from older people, I mean, there's going to be political ramifications for this. So make no mistake about it. If they really do ram this bill through the Senate and it passes and Trump signs it, there's going to be hell to pay. There will be political fallout, and this will end some careers. So this bill is a catastrophe, and the fact that they were hiding it away from us up until this point is an abomination. So, we're going to have to fight. Again, please call your senator and let him or her know that this bill cannot stand, because if it does go through, it's going to be a really tough couple of years until we can move towards a replacement plan for this bill, because this won't stand. This will not stand. I think this will catalyze a monumental shift towards single payer, but at the same time, what we have to go through to get to single payer, it's just there's too much death and destruction that will take place. So I think we can get to single payer without having this bill repealed. So we've got to fight this. Call your senator immediately.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.